So my name is Dr. Neel Shah. I'm one of the infectious disease doctors here at the University of Pittsburgh Medical Center. I'm going to be talking about prosthetic joint infections today. So before we start talking about prosthetic joint infections, we should first define what actual prosthesis is. So a prosthetic joint, a prosthesis, is something that replaces a joint when wear and tear develop over time and there's joint damage. The most common joints involved that require prosthetic joint placement include the hip, the knee, and the shoulder. And the prosthesis itself contains two major components: a metal component, which contains either chromium, cobalt, or titanium, and a smaller plastic component that contains something called polyethylene. So what's the risk of getting a prosthetic joint infection? So prosthetic joint infection is basically infection of this prosthesis that occurs over time. The rate of infection is fairly low, thankfully. So with hips, it's just about 1% of a risk of infection. With knees, it's a little bit higher at 2%, and shoulders are actually less than 1%. But keep in mind that it's projected by 2030 that over 4 million of these procedures will be done yearly in the US alone. So the absolute numbers are large and they are rising over time, which is what makes this clinically significant. How does a prosthetic joint infection occur? So there's a number of risk factors associated with development of a prosthetic joint infection. So the most common way to get an infection of the prosthesis is developing a complication at or near the prosthetic joint site that was put in by the surgeon. So that includes the development of hematomas, which are pockets of blood, or seromas, which are pockets of fluid that occur after a surgery, developing a superficial surgical site infection around the area of the prosthesis. Other things that increase the risk of infection are an underlying immune system that's weakened, either through another medical condition or through medications that the patient is taking. Smoking weakens the immune system and prevents appropriate wound healing, so it serves as a fairly significant risk factor. Obesity is a risk factor for infection simply because there's higher risk of prosthesis damage and a higher risk of developing these superficial infections I was talking about before. And then any type of prior joint placement or prior prosthetic joint infection devitalizes the area and then increases the risk of bacteria or fungus or another organism entering into the joint space. So why does it all matter? So here's a list of 5-year survival rates for adults over the age of 65. And what is striking and what many people don't know is that the development of a knee or hip infection actually has similar and sometimes even worse outcomes to common cancers such as prostate and breast. So prostate cancer, the 5-year survival rate is 79%. Female breast cancer is 75%. Having a knee or hip infection actually has a worse 5-year survival rate. That's 72% for knees and 67% for hips. So when someone develops these types of infections, it's actually a very serious long-term problem potentially, because these infections can cause significant morbidity, mortality, and disability, which can cause other medical problems to contribute to a lack of survival within a 5-year period. It's also very expensive. It's projected that about $1.6 billion in cost every year in the US are attributed to prosthetic joint infections. This includes the need for additional surgeries, the hospitalizations, the complications, the medications. So it's a significant long-term cost issue. And this is, as the numbers increase over time in terms of the patients that get these types of infections, these cost issues will continue to rise. And like I mentioned before, there's significant morbidity associated with these prosthetic joint infections. When someone gets an infection of their prosthesis, they require repeat hospitalizations. They require months of disability because they're unable to walk or ambulate like they should. They require rehabilitation, long-term antibiotics, and these things factor in and also contribute to the cost and that 5-year survival rate I was mentioning before. So what can you do to prevent any of this from occurring? So the first thing I want you guys to understand is that even though this is a real risk for an individual who's undergoing a prosthetic placement. The rates are low, and there are things that can be done to reduce the risk. So first and foremost, weight loss is important, and this is something I'm sure when you go for your evaluation, your surgeons will be telling you. Ideally, a BMI of less than 35 is associated with a lower risk of developing a prosthetic joint infection. Cessation of smoking is extremely important, like I said before, because it reduces the risk of poor wound healing, and it also allows the immune system to optimally function when smoking is stopped. Controlling any underlying medical conditions you have, everything from diabetes to autoimmune disorders, malignancies, as best as possible, will lower the risk of complications for when you go for your prosthetic procedure. Having the proper surgical expertise cannot be underemphasized. So going to a surgeon who has a broad experience in managing prosthetic joint infections, but also in placing prosthesis, will reduce the risk of any potential complications that could occur as a result of your prosthesis placement. And then always follow, of course, your surgeon's recommendations with regards to wound care management, when to bear weight on the joint, and when to follow up. And doing these things could significantly help reduce the risk of infection down the road. Thank you very much for listening to me.